Hi, I'm JC, cancer exercise specialist and clinical exercise physiologist. And in this video, we're going to talk about lower limb lymphedema and exercise. Wow, that is a mouthful. So let's get into it. So the first thing I want you to know is that there is not enough research when it comes to exercise and lower limb lymphedema. Okay, I'm just going to say lymphedema moving forward. But we know we're talking about leg lymphedema and groin. Okay, so there's not enough research in lymphedema in the lower limbs to show exactly what needs to be done. But there also isn't any research to indicate that it's dangerous. So we're going to apply some safety principles to make sure that you are safe and comfortable and you actually see benefits, okay? So the first thing I want you to know is that it is safe to do. There is no contraindication to not exercise. The next thing I want to say is that there is always more benefits to exercise, even in this area, than not exercising. So if you don't exercise, it does increase chance of infection, of inflammation, of lymphedema, and of I'm forgetting the word, blood clots. Blood clots right after surgery. Okay, so exercise in this case is still beneficial. Now, when it comes to lower body lymphedema, there's a couple things you need to be mindful of. Number one is you need to be aware of any signs and symptoms. So you want to be aware of any inflammation, heat around the area, any cuts is very important to make sure that you're aware of. Practicing good skincare as well. Wearing compression garments if your physical therapist suggested that, and making sure that you're not experiencing any more swelling. So you should never have an increase of swelling. If you do, talk to your provider. That doesn't mean that it's related to exercise, by the way. You might have gone for a walk, but maybe your cat scratched you and you had some swelling. That's something that needs to be taken care of. Okay, so it's not always related to exercise, and very rarely is it related to exercise. But it's still important to learn how to manage it for yourself. Now, with that being said, the next thing is you need to make sure that you are doing both strength training and cardio. So cardio would be walking, ellipticals, biking, cycling on a stationary bike, pedaling, so on and so forth, right? So doing constant movement is important because your lymphatic system does not have a pump. So unlike the heart is a muscle that when it squeezes, it sends blood all throughout the body and then it comes back to the heart. So think about it. It's so strong that it squeezes, pumps blood throughout, and the blood comes back. The lymphatic system doesn't have a pump. The pump is the muscles around it. So when you move, when you exercise, when you walk, that actually helps push fluid throughout your body. And that's how it helps. That's the benefit of exercise. That's the mechanism of exercise, right? Because lymphedema is basically fluid that is stagnant or stuck in one place. So you want to get it moving, number one, into lymph nodes that are working, for example, right? And you want to make sure that you reduce how much lymph fluid gets back into the stagnant areas. Exercise helps with that. Compression sleeves help with that as well because they reduce how much fluid comes back into the area. And you can see lymphedema reduce over time with exercise. I have online coaching clients that see those benefits within 3 to 6 months. You'll see 3 months for sure you'll see benefits, and then 6 months obviously you'll see more. So it's important to know that exercise is beneficial. Generally, you want to do anywhere between 6 to 12 reps. And any type of exercise is going to be beneficial, but you want to make sure that you are not also overdoing it. Jumping, for example, running as another example. You could run if you train yourself up to, but that's not somewhere you want to get started with. Okay. Another thing to be mindful of, it's not known what the upper body or upper limit is. So it's not known whether, maybe you're a power lifter and you lifted 500 pounds. It's not known whether you can lift up to that amount safely. That's unknown. Doesn't mean that it's bad. It's just unknown right now. And the most important thing is that you train slowly and gradually. Also, talk to your provider. If they have any limitations, they're gonna let you know. Here's the caveat to that. After surgery, you have limitations. Once you are cleared from surgery, your limitations are gonna be different. So make sure to ask twice. Once right after surgery, and then once you are cleared from surgery, ask them again, do you have any limitations? If they say no, then you are free to start gradually. What does gradually look like? It means adding weight, starting with your body weight, and then slowly adding about 1 to 3 pounds every week or every 2 weeks or so. And that's how you're going to be able to slowly progress and see what your body can do. If you're not experiencing any swelling, you can continue. There is no known upper limit right now, but it is important to make sure you are talking to your provider. You are meeting with a lymphedema specialist when it comes to physical therapy. And if they recommend using a sleeve or some sort of covering, right? Now, when it comes to your upper body can progress normal. You don't have any limitations in your upper body. You can lift as much as you want, as often as you want, within safety guidelines of, making sure you give your body enough rest and things like that. But there is no limits. So you can, lift 20 pounds, 30 pounds, whatever that is for you. You do not need to hold back when doing upper body exercises. So big recommendation is generally you can start off with 2 days a week of upper body and maybe 1 day a week of lower body to see how your body feels and how it reacts. And then you can kind of increase it from there. Normally you do want to make sure that you're active weekly, okay? And with that, it's whether that's a brisk walk, doing the elliptical, something that keeps you moving. You want to avoid being sedentary because that's going to pull a lot of fluid in your body. So think about it this way. Your body is constantly under gravity, right? And that gravity literally pulls fluid down to your feet. It also does it with your blood, by the way. And that pulling is going to cause a pooling effect. So it's going to cause for more fluid to be stuck in your legs and in your feet. Right, so when you do exercise, you want to make sure that you do, for example, some leg raises. So when you're lying down and you lift up your legs, that helps. Gravity is going to pull that fluid again, but it's going to pull it towards your core, and then your core is going to be able to push it through again throughout your body. So you want to make sure that your exercises that gravity is actually helping your exercises, right? So by lifting your legs up, lifting them to the side, that's going to help the muscles move it and pump, but it's also going to help because of the gravitational pull. Swimming also works because that water acts like a massage, for example, that just helps push the fluid throughout your body as well. So those are great exercises that you can do. You can use the pool, you can do them laying down, you can do them sitting down. The biggest thing is you want to move your legs in multiple directions, right? And you don't want to be just standing the whole day, for example. So making sure that you're not standing or sitting too long, because that's when fluid gets stuck in one area. Another thing that helps is twisting your core, doing some core exercises, because that's going to, once again, push that fluid towards the core, and then from the core to the rest of your body. So I'm doing some core exercises. By the way, I'm going to have in the description different exercises that you can do and how to do it. So go ahead and check that out. These are all exercises that I give to my online coaching clients, and that they have given me feedback that they feel wonderful. They can see lymphedema be reduced, and they've also been used in different studies. Now, just because there's not that many studies doesn't mean that there aren't studies. And all the studies show that it is beneficial. There's just not like a ton of studies on exercise and lower limb lymphedema. But so far, it's been shown to be beneficial. It makes sense that it's beneficial, but we just don't have exact guidelines for it. There's a lot of unknowns, but what I've given you so far, if you follow that, you are very likely, number one, to be safe, to be comfortable, and see improvements in lymphedema. I'm also going to have a lower limb lymphedema guide to show you how to exercise, and there's a free guide on exercises that you can do that comes with 2 workouts a week that is free in the description below. So go ahead and check that out, and have a great rest of your day.